Hello. Today is Saturday, October 3rd, 2020. This is Dr. Rhonda Johnson, and today we're going to be talking about a serious mental health condition during this pandemic called Coronaphobia. Now, I want to start by saying a disclaimer. I am not a mental health professional. My expertise is pediatrics and public health, but we're going to be talking about a mental health condition. So since this pandemic started, have you had bouts of panic, suffered occasional bouts of depression? Have you demonstrated obsessive behaviors like obsessive cleaning and disinfecting? Have you experienced distress or avoidance of people? Have you experienced panic, anxiety, hoarding, such as hoarding of toilet paper, paranoia, feelings of hopelessness? Well, guess what? You know you're not alone, and you may have what experts are now calling coronaphobia, a catch-all phrase for the fear and emotional and social strain experienced by the general public in response to COVID-19. So let's pull this name apart. Well, you know what corona means, but what is a phobia? Well, according to the American Psychiatric Association, a phobia is an anxiety disorder characterized by persistent, excessive, unrealistic fear of an object, person, animal, activity, or situation. What a phobia does is it makes people avoid things that trigger that fear. And when avoidance isn't possible, it creates a lot of anxiety and stress. So coronaphobia is a new emerging phobia that is specific to COVID-19. So what is this, you may ask? Well, experts have defined it as an excessive triggered response of fear and contracting COVID-19. This leads to excessive concerns over physiological symptoms. For example, every time you sneeze and cough, you wonder if it's the Rona. Significant stress about personal and occupational loss, increased safety-seeking behaviors, and avoidance of public places and situations. And the bottom line is this causes marked impairment in daily function. I'm not talking about just being self-protective. I'm talking about where you are really impaired and you have a lot of anxiety about situations or people that involves getting infected with the virus. So for example, if you have an intense fear of meeting people, leaving the house, traveling, reading the updates, or going for work outside, that could be a symptom of coronaphobia. And experts say that people with coronaphobia manage their fear and anxiety sometimes by engaging in avoidance behaviors such as being afraid to use public transportation, touching any surfaces, being in open places, being in closed places like hotels, shopping malls, movie theaters, indoor stadiums, attending any public gatherings, and even standing in line. People with coronaphobia also overindulge in health-related safety behaviors like washing their hands excessively. And they can also be engaged in reassurance behaviors, such as constantly checking their temperature, or they keep getting COVID-19 tests, or they self-medicate by taking mega vitamins and supplements, or they redo their sanitation precautions over and over and over. In addition, experts say people with coronaphobia struggle with having a loss of faith in the health infrastructure. They worry about contraction of COVID-19 by heads of state, so this would really probably upset them about the news of President Trump. And infodemia, meaning they're consuming an excessive amount of information. Now, for most people with coronavirus, their fears are temporary. But with coronavirus phobia, these people can have serious avoiding of seeking medical care, and strict and rigid self-isolation, and be debilitated with fear. So again, there's a difference between being careful and having coronaphobia. Psychologists are also saying that people that are suffering from this are experiencing high levels of hopelessness, a spiritual crisis, and suicidal ideation. And some folks are trying to cope with their anxiety by abusing alcohol and drugs. So the bottom line is coronaphobia is real, and it's got to be taken seriously if you know someone that's being affected this way, because it can have a detrimental effect on their day-to-day lives. So mental health professionals are available to treat this. It's being recognized frequently in the mental health community, and people with debilitating anxiety, there's medication that they can take to help treat debilitating anxiety. But for some folks who might be on their way, not that serious, these tips can help. So reassure yourself that it's going to one day get better. Change your information diet. Wean yourself from all this news and do other things that take your mind off your fears. Another suggestion is to channel your anxiety to action. Focus on what is in your control and take active steps to look after your mental health, such as sleeping well, exercising, doing some fun or relaxing activities, and staying socially connected to others. Something I've done is journaling. Write down how you feel, put on a piece of paper, and if you want, throw it away. It can make you feel like you're emptying your mind of your worries. Tap into your faith as your superpower. Talk to people who can help you, like mental health professionals. I heard an example that I loved one day. Start a happy kit. Look at what makes you happy and do these things. Maybe it's music, comedy, movies, sitting on the porch. Another thing is to have a positive perspective. Another suggestion is to take your medication if you have mental health issues. Another suggestion is to start a new hobby. Learn how to sew, crochet, garden, read, bicycle, tai chi, yoga, fishing, hiking. You're only limited by your imagination. So, folks, again, coronaphobia is real. It can be debilitating. Mental health professionals are able to help, but you have to seek help, and you have to take this seriously. All right, this is Dr. Rhonda Johnson. My views are my own. Stay blessed and have a wonderful day.